My first impression of Dr. Petrovich was super nice, very willing to help, extremely knowledgeable and friendly.
He's empathetic, he's trustworthy, he really genuinely cares about his patients.
I think that he gets to know each one of his coworkers, and through the years we've really, our doctor group and our nurses, we're a family, and we are what we call trauma bonded. We go through the worst things, and then we have to turn around and take care of a patient that might be there for finger pain. To know that we're going through that together, and Mike is a leader in the department, I think that we're all very lucky to work with him.
Well, what makes a good doctor is somebody that listens to your patients and somebody that listens to your nurses and then everybody else on the staff. It could be the environmental services person, it could be the tech. Every one of those people in the hospital has seen a number of patients, and if they see something that doesn't agree with them, if you listen to them, they can save your bacon sometimes.
It is very rare that I see a doctor walk into a patient's room. It could be a little elderly lady there with a broken hip, and she's in a lot of pain. He will sit down at the bedside, grab her hand, and say, "What's hurting on you?" You could tell that he really cares about people.
The thing that makes this team really stand out to me is that when you're working single coverage, you're the only doctor in the ER. I can trust that not only are the nurses gonna alert me to stuff, but take action before I even get there. And so they allow a single coverage, or when we're busy and there's multiple doctors there, for the patients to always come first and for those critical actions to be done in the moment.
I think what makes him deserving of this award is his unparalleled positivity. He works super hard. He gives every shift his all. Personally, I've seen him walk into a room when someone is having a really bad day and he's making them laugh.
Mike is always willing to work just a little bit harder to help prevent us from going on divert or having to overflow patients. His calm presence makes me feel like everything's gonna be okay when we're in the midst of chaos.
What my patients mean to me is why we do the job, right? In the ER, can't do it over the phone, right? Every patient you see, you examine, you get to explore, which is most of the time a bad day in their life that they're having, and you're trying to make it better, which to me is the whole reason to come to work.
Nobody else deserves this Crystal Angel Award more than you. I literally can't think of one other person who deserves to have this, so congratulations.